in the end, of course, the provider groups need to take responsibility for this and help and really orient this towards the patient best into the future. That's going to be successful. We need to collaborate with others in terms of the design, et cetera, but the responsibility for this is going to be with providers, and really it should be patient-focused. There's two things for motivation. First of all, we want to be able to sustain our business and continue to serve our patients, and the system around us is changing so fast you have to adapt. You can't stay the way you were. But I think second, and it's quite fundamental, I don't think the patients feel that they've been really well served by healthcare. They're concerned about quality, they're concerned about high costs, they're concerned about the disintegration of the system. So we're changing in addition to supporting our business and meeting their needs. Well, the competition is, I think, first of all, it's to be sure that you provide a service that patients want, so you obviously keep and increase your market share. You'll be competing for that. You're competing, I think, also for the share of public interest in what the future is going to be, because Mayo Clinic can see a number of patients face to face, but as social media and extended affiliate networks and Mayo Knowledge and Mayo Services become more digital, you're going to be competing with other people for the share of hearts and minds of folks that actually never come to Mayo Clinic. This is an article by Drew Altman that I referenced in my talk today, who spoke about the three things that we've been trying to do to reform healthcare. He talked about the regulators and can we put enough rules in place that will reform healthcare. Then there was the folks that thought about consumer-directed care, and their model was actually, let's put the hands of the decision-making consumers. If we give them information, then they will drive the change. That's still in place some, but sick people aren't really good change agents. And the third way of saying that the healthcare providers really need to take responsibility for this change themselves. They need to then transform their system, become a, quote, smart, end quote, healthcare system, put in place the analytics and the tools you need to understand the utilization of your system, then align your financial model, align your purpose, and align your care around that. And that would be the third way. I think that the change is occurring actually fairly quickly if you look back through the history of healthcare, but it's not as fast as we want because these forces aren't aligned really well. So you end up in this left behind or too far, too fast kind of a scenario. If you embrace all the new systems and your payment system isn't rewarding decreased utilization of care, of course you lose revenue. And if you say, gosh, it looks like we have a great revenue source here in the old system, and you miss the changes where people are going to be responsible for a majority of the healthcare costs out of their own pocket, that's a, quote, retail market, end quote. If you don't get that going, it's going to be a loss of market share. This is not a really broad performance avenue. You can go wrong on either side. And so I think everybody is taking it step by step, because one of the things we must do is meet the needs of our patients. We also need to meet our payroll because it's a private business. And that's really why it's going slowly right now. The system's not perfectly aligned. We can see it coming into alignment, but it's not there yet. Our job right now is not to really complain about what's been happening, but to define the future state and motivate people to go there with us. And I think if we continue to do that and recognize how complex the needs are, we'll move forward and look back on the 21st century, maybe the first 20 years, to be frank, as a time when we started really doing a significant change in the way we provide healthcare in the country.